Actually, at this meeting we had different sessions, and it's very stimulating for all of us knowing that we are making progress for the treatment of aplastic anemia. The severe working party of aplastic anemia is a quite unique landscape, because we are able to collect data not only on transplantation, which is of course the topic of this meeting, but also on other treatments like immunosuppressive treatments, as well as aplastic anemia as a disease, considering that we have different forms of aplastic anemia. We have acquired form, but also inherited forms. What was great at this meeting is that we have many new data, we have many studies ongoing. Some of these studies were already presented at previous meeting and now have been published, but we have new data that we are generating right now. I think that it was great from our side that after, of course, the bad experience of pandemic, we are back to refresh and renew all our science in the field. At the moment, we are discussing many studies. As you know, we are going to we present actually in the plenary session the final report of our RACE trial. This was a fascinating study because this was the largest study in the field of aplastic anemia ever, enrolling 200 patients receiving immunosuppressive treatment, either according to the standard immunosuppressive regimen or standard regimen plus Eltrombopag. The data of this study, the initial data, were presented at the meeting in 2020, just in the pandemic era, and then they were published in the New England a few months later. Now we are back to the analysis. We have the final analysis at 2 years from all patients, and eventually we confirm, even in the long term, that there is a huge difference, clinically and statistically meaningful, in terms of overall response and complete response rate, and this translated into a much better disease-free survival and event-free survival. Actually, even looking at overall survival, we are just at the border for statistical significance, and this is great because eventually this study led us to establish the new standard of care for patients ineligible for transplantation, which is now based on triple therapy with ATG, cyclosporine, and additional Eltrombopag on top of that. Of course, this is not the end of the study. When I was referring my previous answer to all the studies that we are conducting, well, this is the prospective study that has been completed, but now we are collecting data for the long-term analysis, looking for events up to 10 to 12 years. So we are just collecting data for the 5-year follow-up. Hopefully we will be able to present this data at this meeting next year. And this is very important because in addition to survival, we know that there are some events which are critical, like evolution to malignant myeloid diseases, as well as PNH, but also the discontinuation of immunosuppression is very relevant, as well as all the rescue treatment that this patient may need. Of course, it will be only collecting all this information that we will continue to inform colleagues and friends about the best treatment to offer to this patient as frontline treatment, as well as subsequent treatment that some patient may need.